It starts with a headache, a sore back, or maybe some joint pain after gardening. You reach into the medicine cabinet, grab a bottle of ibuprofen, and feel relief within the hour. It's one of the most widely used painkillers in the world, and it's easy to see why. It works. But here's something most people over 50 don't realize. The very medication that brings short-term comfort might be quietly causing harm beneath the surface. Many adults take ibuprofen regularly, sometimes even daily, assuming it's safe because it's available over the counter. And while occasional use is usually fine, consistent or high-dose use, especially in older adults, can carry some serious health risks. These side effects don't always announce themselves loudly. Some start with a little fatigue, a strange stomach sensation, or a slightly elevated blood pressure reading. Others may take years to show up, but when they do, they can be life-changing. In this video, we'll explore 9 of the most important side effects of ibuprofen that you should never ignore. If you or someone you care about uses this common pain reliever, even sparingly, this could be one of the most important health videos you watch today. 1. Stomach damage. One of the most common and well-documented risks of ibuprofen is the harm it can cause to your stomach. While the drug is effective at reducing inflammation and pain, it also reduces the protective lining of your stomach, which can leave you vulnerable to ulcers, irritation, and even internal bleeding. For someone over 50, whose digestive system may already be more sensitive, this side effect can become a serious issue over time. You might not feel the damage right away. It often starts subtly, a bit of discomfort after meals, occasional nausea, or that burning sensation in the upper abdomen that's easy to blame on something you ate. But as the stomach lining continues to thin and the acid has less protection to push against, those small symptoms can quickly turn into bigger problems. Some people may begin to experience black stools, which can be a sign of bleeding, or persistent abdominal pain that doesn't go away with rest or food. What makes this especially dangerous is how easy it is to overlook. Many people continue taking ibuprofen, unaware that it's slowly harming the very system they rely on to digest and absorb nutrients. And because stomach ulcers don't always cause clear symptoms at first, the damage may already be advanced by the time it's caught. If you take ibuprofen regularly, especially on an empty stomach or without food, talk to your doctor about how to protect your digestive system. There are safer ways to manage pain that won't risk long-term harm to your stomach. And sometimes making even small adjustments in how you take a medication can make a big difference in how your body handles it. 2. Kidney strain or failure. Your kidneys work quietly in the background every day, filtering waste from your blood, balancing fluids, and keeping your body running smoothly. But when you take ibuprofen, especially for extended periods, this powerful pain reliever can start to put pressure on those vital organs in ways most people don't realize. Over time, ibuprofen can reduce blood flow to the kidneys, which may lead to decreased kidney function or even kidney failure in more serious cases. This risk is even higher for people over 50, particularly if you already have high blood pressure, diabetes, or are taking other medications that affect kidney health. The danger isn't just in high doses either. Even standard daily use taken over months or years can slowly wear down your kidneys without showing obvious symptoms at first. Some people may begin to feel more tired than usual, notice swelling in their legs or feet, or have changes in how often they urinate. Others may not feel anything at all, until a routine blood test reveals that kidney function has dropped. That's what makes this side effect so tricky. It sneaks up quietly, and by the time it's noticeable, the damage may already be done. The good news is this risk can often be managed or avoided entirely with the right guidance. If you're relying on ibuprofen often, ask your doctor if there are safer alternatives for your situation. And if you've been taking it long-term, getting your kidney function checked could be one of the best things you do for your health this year. 3. High blood pressure. You may not expect a pain reliever to affect your heart, but ibuprofen can have a quiet influence on your blood pressure, one that often goes unnoticed until it becomes a problem. For adults over 50 who may already be monitoring their heart health, this is an especially important risk to understand. Regular use of ibuprofen has been linked to a gradual rise in blood pressure, even in people who never had a history of it before. The way it works is subtle. Ibuprofen can cause the body to retain more sodium and water, which increases the volume of fluid in your blood vessels. That added pressure inside your arteries means your heart has to work harder to push blood through, which over time can raise your blood pressure and increase strain on your cardiovascular system. This effect may be even stronger in people who are already on medication for high blood pressure, as ibuprofen can reduce the effectiveness of those drugs. What makes this risk so deceptive is that high blood pressure often has no symptoms at all. You may feel perfectly fine until you check your blood pressure at a routine visit and notice the numbers creeping up. And because many people take ibuprofen on and off for weeks or months at a time, it's easy to miss the connection. If you're managing hypertension or simply want to protect your heart health, it's worth discussing with your doctor how often you use ibuprofen and whether it might be time to explore safer options. Keeping your blood pressure in check is one of the best ways to prevent heart attacks and strokes, and that means every medication, even a simple pain reliever, deserves a closer look. 4. Heart attack or stroke. One of the most serious risks linked to long-term or high-dose ibuprofen use is its potential to increase the chance of a heart attack or stroke. It may seem surprising that a medication used for something as common as joint pain or headaches could have such a serious side effect. But research has shown that non-steroidal anti-inflammatory drugs like ibuprofen can interfere with blood flow and increase clotting, especially in older adults. The danger doesn't usually come from a single dose. It builds over time. If you're taking ibuprofen regularly to manage arthritis, back pain, or chronic inflammation, the risk can slowly grow, particularly if you already have a history of heart disease, high cholesterol, or high blood pressure. Ibuprofen can cause your blood vessels to narrow slightly and increase the stickiness of platelets, which are the cells responsible for clotting. This combination can raise the chances of a clot forming and blocking blood flow to the heart or brain. You might not feel anything out of the ordinary until it's too late. Sometimes the first sign is chest pain, shortness of breath, or sudden weakness on one side of the body, signs of a serious cardiac or neurological event. That's why it's so important to keep your doctor informed if you're using ibuprofen regularly, even at over-the-counter doses. There may be other ways to manage pain that don't come with the same risks, and if ibuprofen is necessary, your doctor can monitor your cardiovascular health closely while you're using it. Your heart does so much for you every day. Don't let a pain reliever quietly undo that work. With the right knowledge and care, you can protect both your comfort and your long-term health. Liver damage. The liver is one of the body's hardest working organs. It filters toxins, supports digestion, and helps process medications, including ibuprofen. While liver damage from ibuprofen is rare, it can still happen, especially with long-term or high-dose use. For people over 50 whose liver may already be processing multiple medications or managing age-related changes, even small shifts in liver function can have a bigger impact than expected. Ibuprofen is broken down in the liver before it's cleared from the body. When taken occasionally, this usually doesn't cause any problems. But when used frequently or in combination with other medications that affect the liver, it can place added stress on this vital organ. Over time, the liver can become inflamed, a condition known as drug-induced hepatitis. If left unchecked, this inflammation can lead to more serious liver damage or impaired function. What makes this side effect particularly tricky is that the early symptoms are often vague. You might feel more tired than usual, lose your appetite, or notice mild nausea. In some cases, people may develop yellowing of the skin or eyes, known as jaundice, which is a clearer sign that something isn't right. Routine blood work can detect early signs of liver trouble even before symptoms appear. That's why it's important to let your doctor know how often you're using ibuprofen, especially if you are also taking other medications or have a history of liver issues. Your provider may suggest an alternative treatment or monitor your liver function regularly to keep things safe. Taking care of your liver doesn't mean giving up pain relief. It means making thoughtful, informed choices that support your body's long-term strength and resilience. 6. Ringing in the ears. It might surprise you to learn that one of the side effects of ibuprofen is something you hear, not feel. Some people who take ibuprofen regularly or in high doses begin to experience a persistent ringing, buzzing, or humming sound in their ears, a condition known as tinnitus. For those over 50 who may already be sensitive to changes in hearing, this side effect can become especially frustrating and hard to ignore. Tinnitus caused by ibuprofen doesn't always appear suddenly. It can start as a faint noise you notice only at night or in quiet rooms. Over time, it may grow louder or more constant, making it harder to relax, concentrate, or fall asleep. While not everyone will experience it, those who do often find it deeply unsettling, especially because it's not always clear what's causing it. The reason behind this effect isn't fully understood, but it's believed that ibuprofen may interfere with blood flow to the inner ear or irritate the delicate structures responsible for hearing. In some cases, the ringing goes away once the medication is stopped. In others, it may linger or become permanent. If you begin to notice any unusual sounds in your ears, and ibuprofen is part of your routine, bring it up with your doctor. They can help determine whether it's related to the medication or if something else is at play. There may be alternatives available that ease your pain without putting your hearing at risk. Your ears deserve the same attention and protection as any other part of your health. Don't let something that's meant to bring relief end up causing new stress. The sooner you catch the signs, the better your chance of keeping the noise at bay. 7. Allergic reactions. For most people, ibuprofen is a safe and familiar medicine. But like any drug, it has the potential to trigger allergic reactions, some mild, others more severe. Allergic responses can happen to anyone, even if they have taken the medication before, without problems. And for those over 50 whose immune responses can become more sensitive over time, this risk deserves careful attention. An allergic reaction to ibuprofen might first show up as something minor: a red, itchy rash, slight swelling, or hives. These symptoms may appear within hours of taking the drug or even after a day or two of use. Often people don't immediately associate these signs with ibuprofen, especially if they've used it many times in the past. But ignoring these early warnings can be risky because in rare cases, the reaction can become life-threatening. More serious responses include difficulty breathing, tightness in the chest, wheezing or swelling of the lips, tongue, or throat. This type of severe reaction, known as anaphylaxis, requires immediate emergency care. Even though it's uncommon when it does happen, every second counts. If you've ever experienced even a mild allergic response after taking ibuprofen, it's important to let your healthcare provider know. They may recommend switching to another type of pain reliever and recording the reaction in your medical history to prevent future issues. You should never feel nervous about taking medication, but you should feel empowered to recognize when something's not right. Your body is always communicating with you through your skin, your breath, your comfort. The better you listen, the better you'll be able to protect your health and make safe, confident choices moving forward. 8. Anemia or blood issues. Ibuprofen may seem harmless on the surface, but over time, it can quietly affect your blood, especially if you're taking it regularly. One of the lesser-known risks of long-term ibuprofen use is the development of anemia, a condition where your body doesn't have enough healthy red blood cells to carry oxygen effectively. For adults over 50 who may already be managing other health concerns, this can have a real impact on daily energy, focus, and overall well-being. Anemia caused by ibuprofen typically develops gradually. It often stems from slow, hidden bleeding in the stomach or intestines, which may not cause noticeable pain or visible symptoms at first. You might feel more tired than usual, short of breath after light activity, or even lightheaded when standing up. These symptoms can be easy to brush off or confuse with normal aging. But if blood loss continues unnoticed, your red blood cell count can fall low enough to trigger more serious fatigue, irregular heartbeat, or reduced exercise tolerance. In some cases, lab work during a routine checkup may be the first clue that something's wrong. If you've been using ibuprofen often and notice that you're more easily exhausted, don't ignore it. Let your doctor know and ask if a blood test might be helpful. If anemia is detected, it may be time to adjust your treatment or look for other pain relief strategies that don't carry the same risk. Your blood is your body's fuel system. and keeping it strong is essential for living well. Small warning signs are often your body's way of asking for help. Pay attention to them and take steps early to protect the energy and vitality you deserve. 9. Drug interactions. As we get older, it's common to take more than one medication each day. That's why understanding how ibuprofen interacts with other drugs is so important, especially for people over 50 who may be managing chronic conditions. While ibuprofen is available over the counter, it's far from harmless when combined with other common prescriptions. One of the biggest concerns is how ibuprofen affects people taking blood pressure medications. It can reduce the effectiveness of these drugs, making it harder to keep your pressure under control. Over time, this can increase your risk of stroke or heart problems. If you're also on diuretics, ibuprofen may further stress your kidneys by limiting blood flow and fluid regulation. Another serious interaction involves blood thinners, such as warfarin or aspirin. Ibuprofen can make bleeding more likely by affecting how your blood clots. If you're already taking something to thin your blood, even small doses of ibuprofen can tip the balance and raise your risk for internal bleeding or bruising. There are also concerns when combining ibuprofen with corticosteroids, certain antidepressants, and even some supplements. These combinations can increase the chance of ulcers, digestive bleeding, or liver strain without you even realizing it's happening. Always let your doctor or pharmacist know if you're using ibuprofen regularly, even if it's just the occasional pill for joint or back pain. They can help you find safer options or make sure the combination is being properly monitored. The goal is simple: manage your pain without adding hidden risks. With a little awareness and communication, you can use medications wisely and keep your body working the way it should. Ibuprofen is one of the most trusted medications in the world, and when used occasionally, it often brings quick relief. But like many over-the-counter drugs, it carries risks that aren't always obvious, especially for those of us over 50. As we've seen, the side effects can range from digestive issues and hearing changes to heart concerns and drug interactions. Some develop slowly, others come with little warning, but all deserve our attention. This isn't about fear, it's about awareness. By understanding how ibuprofen can affect your body, you're in a better position to make safe, informed decisions about your health. If you take it regularly or alongside other medications, talk to your doctor, ask questions, get curious, because protecting your long-term well-being starts with the small choices you make every day. And remember, there are often safer alternatives and strategies for managing pain. You don't have to go it alone. If you found this video helpful, give it a thumbs up and share it with someone you care about. Drop a comment below if you've had any experience with ibuprofen you'd like others to know about. And don't forget to subscribe to MediMint, where your health always comes first. Thanks for watching and take care of yourself.